Determination of total calcium in blood. For determination of total calcium in blood, we are going to perform titrating procedure. First, we are going to precipitate calcium ions from blood plasma sample with ammonium oxalate in order to form calcium oxalate. For that purpose, we are going to take the centrifuge tube and we are going to pipette 2 milliliters of blood plasma. Then 1 milliliter of ammonium oxalate. In order for the calcium oxalate to completely precipitate, we need to leave the centrifuge tube at room temperature for at least 30 minutes. After 30 minutes, the centrifuge tube should be placed in centrifuge and centrifuge for 10 minutes, 300 rotations per minute speed, in order to separate the precipitant calcium oxalate from the rest of the solution. So in order to centrifuge test tube, we need to open the lid and place the centrifuge tube to the proper position. Notice that the rotor should be balanced, so in order to do that, we're going to take one other centrifuge tube with the same volume of solution in it. We're going to place our test tube in opposite places. Close the lid to hear the click. Press the turn on button. Adjust the time to 10 minutes. And then speed up slowly the centrifuge to 3000 rotations per minute. And follow the speed on a scale showed by needle. Remember that you should never leave the centrifuge alone during the centrifuge process. So when the time is up, the centrifuge is slowing down automatically, both green lamps are on, we can turn the speed to the 0 point, and we have to wait for those 2 green lamps to turn off to be able to open the lid. Wheel gently towards the wall and open the lid. Wait for a few seconds for the rotor to stop. And take your centrifuge tube. Next step is to discard the supernatant because we need the precipitate of calcium oxalate. In order to wash precipitate from any kind of possible interfering substances, we need to wash it up with the ammonium solution, adding 5 milliliters of it to the test tube. Resuspend the precipitate by stirring with a glass rod. Resuspended precipitate should be separated from the rest of the solution again by centrifuging for 10 minutes at 3000 rotations per minute. For second centrifuge process, we shall open the lid again, and according to the well-known principles, again position our test tubes or centrifuge tubes to opposite positions in rotor. Close the lid to hear the click. Again, adjust the time to 10 minutes and slowly the speed to 3000 rotations per minute. So when the time is up, again, centrifuge is slowing down automatically. We can bring the speed to the 0 point and wait for the 2 green lamps to turn off to be able to open the lid. Lamps are off and now we can open the lid. We shall wait for the rotor to stop. Since this is the last centrifuge process, we can switch the centrifuge off. Take the centrifuge tubes, discard the supernatant, and dissolve the precipitate. In order to dissolve the precipitate of calcium oxalate, we are going to take diluted sulfuric acid and add 3 milliliters of it to the centrifuge tube. And mix until the precipitate is completely dissolved. If necessary, you should place the centrifuge tube for a couple of minutes in a boiling water bath to speed up the dilution. When the precipitate of calcium oxalate is completely dissolved, we may start the titration. Adjust the level of potassium permanganate solution to zero level of the burette. And start titration by adding drop by drop of potassium permanganate solution directly to the centrifuge tube till the color of the solution remains pale pink for approximately 30 seconds. When the titration is completed, read the volume used and calculate the result using the equation provided in the operating manual.